All right, hi, I'm Grace Narby, and this is the social ecological theory applied to myself. Individually, I am 21 years old. I started coming to Altman my senior year of high school for the CCP program, and now I am a senior in the BSN program, and I graduate next semester, thankfully. Um, the we're getting to the light at the end of the tunnel. I got my STNA while I was in high school, and I've been a nursing assistant since then. Um, I am a weightlifter. I've always been huge with my health, and I used to do CrossFit and play volleyball. Um, and then I would say I'm a very resilient person, and different life situations have made me grow stronger emotionally, um, that have led me to some strong resilience. And I'm a very avid mental health advocate. I live with my mom and stepdad, and then I have a German Shepherd and English Mastiff named Marshall and Henry. I'm the youngest of three. Well, I'm the youngest of four, including me, I guess. All my other siblings live with their significant others. My dad passed away when I was about 6 years old, and I was alone with him when he passed. This is very traumatic and unexpected event in my life that I would say has led me to resilience, because the effect of that trauma really led me into these mental health issues. So I've gone through many different mental health areas like psychotherapy, psychiatry, intensive outpatient, partial hospitalization because of my mental health. And that's the whole reason why I got into nursing, because I want to be a mental health nurse and hopefully a psychiatric nurse practitioner someday. Um, then I have my nursing friend group that I'm really close with, that we have built some strong camaraderie together through these years. And then I also have a work friend group that I am close with because I have been working at my job for a while. Organizationally, Altman College is obviously the college I go to, which is connected to the hospital, and many other clinicals are here at the hospital. And many of my clinicals have been at this hospital. I've also had clinicals at Akron Children, Sunrise Vista, Conquest, and now I have my community clinical at Brown Local Schools. Danbury Senior Living is the assisted living facility I work at that is right up the street from me in North Canton. I used to work at the other Danbury that was independent living around the corner from me in dietary while I was in high school. So I utilize my SCNA license at this assisted living facility. They also have memory care as well, but I stay on the assisted living side. Once I get my RN, I will utilize this and hopefully the ER at first to keep my bedside nursing very strong, and then hopefully switch over to psych at Akron Children's, which is my end goal, or at least my end goal with my RN, and then hopefully progress into psych NP. Altman College and Altman Hospital are affiliated with one another. The reason why I came to this school is because I felt like being attached to a hospital would be an eye-opening opportunity, and we have such a close access to nursing. I work at one of the long-term care facilities, like I said, in North Canton, which is called Danbury. When one of our residents is sicker, they either get sent to Mercy or Altman Hospital in Canton. And then one of my clinicals for mental health was at Conquest, which is a detox facility. They have little pop-up outpatient facilities. I've seen one in Canton, excuse me. And there is also a little area of the hospital that does have Conquest. They are affiliated with each other, obviously, but like aren't connected in a way. And before they do let anyone come in, they have to be cleared of like other medical issues besides the addiction. And then for my community clinical, I'm at Brown Local Schools, which is in Carrollton County. also called Malvern, which is a very rural area. Within the past couple of years, they adopted the use of telehealth through Altman, and they have a nurse practitioner that does do the diagnosing and treating of these kids and faculty that are a part of this telehealth if they need it. And they have a head, the nurse that I'm watching or shadowing that runs it is also a part of the Carrollton Health Department, and she does a lot of studies and try to figures out how to better these people's health and lives and what these people need. Public policy, COVID has put a lot of restrictions that have been lifted. It is still followed by schools, hospitals, and work. Tested positive and symptomatic, then you have to stay home and quarantine, and you can return back after, if, even if you still have mild to moderate symptoms after day 5. Wearing masks is then suggested. We just lifted our mask mandate at my work, but Altman, you still have to wear a mask with patient care and walking around in the hospital. Smoking and tobacco use is against Altman policy, as well as at Brown Local Schools that I'm at right now. Altman nicotine tests when hired and if hurt on the job. My public health nurse at Malvern is getting certified to teach a tobacco cessation class because vaping is such a high prevalence in all of these schools. These kids think it's cool. And then these kids that are caught vaping are reprimanded at Malvern and can end up going to teen court, which is a Help with Bridges to Wellness program. There was a child that came into the clinic at Brown with suspicious physical marks and bruises on her body. Her family has a history of CPS called on her and her brother, and they were taken out of the house back during Christmas time, and now the court system let them go back, and this poor 6-year-old, like, she had these bruises on her skull, and it was just, she wouldn't tell us what really happened, and it's just a sad situation. So CPS needs to get involved, and these social workers work really closely in that at the school. And then there's also social workers in the hospital that help with different aspects of coping, emotional support, and all the different needs that do come into play other than the need to get your physical health fixed.